Hello, and welcome to our first video in the series, Let's Talk About It, where we're going to discuss health topics, nutrition topics, or things that happen to be of interest to me at the moment. Today we're going to kick off the series by talking about breast cancer. Why? Because it's timely. October is Breast Cancer Awareness Month, and that's wonderful. But awareness is not enough. On a daily basis, I hear misconceptions from patients about breast cancer. And those misconceptions can be dangerous. So I want us to move from awareness to education. We're going to start off by addressing 5 commonly held beliefs about breast cancer that are all myths. Myth 1, breast cancer never affects men. Although it's true that the vast majority of cases of breast cancer are diagnosed in women, men can also be diagnosed with the disease. However, it is much less prevalent. To give you an idea of the ratios, approximately 1 in 8 women will be diagnosed with breast cancer over the course of their lifetime. However, for men, that number is 1 in 1,000. So while it's not very common, it definitely can occur. Myth 2, I'm too young to worry about breast cancer. While it's true that the possibility of being diagnosed with breast cancer increases as you age, breast cancers can be diagnosed in very young women and even in children. So if you're noticing something is changing, is different, is just not right, please talk to your doctor no matter how old you are. Myth 3, if nobody in my family's ever had breast cancer, I don't have to worry about it. While family history or genetics does play a role in determining if you are more at risk than the average woman, it is definitely not the whole story. Other risk factors come into play in determining whether or not you may ever develop the disease. So, even though nobody in your family has ever been diagnosed, you may still develop breast cancer at some point in your life. So, don't skip your screenings. If I'm diagnosed with breast cancer, I'll have to have a mastectomy. The way we treat breast cancer has changed radically over the years. While mastectomy used to be the standard of care, now for most patients, breast conservation therapy is an option. With this therapy, you will have a small surgery to remove the diseased portion of the breast, and the remainder of the breast will be left in place. This is then followed by radiation and sometimes chemotherapy. The benefit of this is that you have a smaller surgery, you don't have to have a complete mastectomy, you heal faster, and for most patients, outcomes are equal between the two options. Myth 5, if I'm going to get breast cancer, I'm going to get it. There's nothing I can do about it. Like we've talked about before, some people are at a higher risk of developing breast cancer than the quote average woman. However, that doesn't mean that they absolutely will. We all have what are called risk factors. And these are traits about ourselves that put us at risk of developing this disease. For example, family history and genetics are some that nobody can change. It is what it is, and you're born with it. However, we all also have risk factors that we do have the ability to modify. Things like whether or not you smoke, how healthy your diet is, how much alcohol you consume, if you get much exercise. So we all owe it to ourselves to know what our risk factors are and what we can do about them. So now that you know a little bit more about breast cancer, what's the next step? Number 1, if you see something, say something. If you're noticing changes to your own breast, lumps, bumps, discharge, skin changes, pain, swelling, anything that is not normal for you, tell your doctor right away. If you don't have a doctor, check the link below for the Breast Cancer Screening Organization. It's a nationwide program to help provide low or no cost breast cancer screenings to women who need them. Number 2, learn more. Find out your family history so that you can know if you are at a higher risk than the average woman. Also learn about what your personal risk factors are. Links below for both of those tools. And then number 3, talk to each other. Talk to your daughter, your cousins, your sisters, your best friend about breast cancer. Yes, we are all aware, but we need to be more educated. Feel free to share this video, talk to your doctor, and a bit of a disclaimer. Yes, I am a doctor, but I'm not your doctor. So anything you get from this podcast, please discuss with a healthcare provider who's familiar with you and your personal medical history. Hope you guys have a great week.